Good afternoon. Thank you very much for having us today. Today I'm going to present to you a study research that was done in our National Institute of Urology and Nephrology between May and October 2017 about the role of Sclerostin, fibroplastic growth factor 23, and Klotho in hemodialysis patient. Chronic kidney disease mineral bone disorder is defined by abnormalities in mineral and hormone metabolism, leading to decreasing bone health with the presence of soft tissue calcification. It is initiated early in the course of kidney disease and is associated with a change in the morphology and function of osteocyte. Sclerostin is a glycoprotein secreted by osteocyte is considered as a new marker for osteoblastic activity. It increases with declining renal function and is elevated in hemodialysis patient. As sclerostin is produced by osteocytes similar to fibroplastic growth factor 23, it might upregulate the fibroplastic growth factor production. In turn, fibroplastic growth factor 23 may act as mineralization inhibitor. In the kidney, the fibroplastic growth factor 23 acts on the fibroplastic growth factor receptor and alpha-Klotho co-receptor complex to reduce the expression of the sodium phosphate cotransporter in the proximal tubules of the kidney, inhibiting the reabsorption of the phosphate-inducing phosphaturia, and it also decreases the 1,25-dihydroxy vitamin D synthesis, and thus it lowers the intestinal absorption of the phosphate. And the circulating soluble Klotho or S-Klotho results from the transmembrane Klotho shedding, and it acts on the phosphate and calcium tubular transport. Decreased transmembrane Klotho prevents action of fibroplastic growth factor 23 and decreases soluble Klotho. Thus, levels of S-Klotho could represent a marker of chronic kidney disease, mineral bone disease. Aim of the work: we measured a few parameters to examine the association between serum sclerostin, fibroplastic growth factor 23, Klotho, parathyroid hormone, high sensitivity C-reactive protein, and phosphorus level in hemodialysis patients. So patients and methods. So a total of 63 patients on hemodialysis, on maintenance hemodialysis, 3 sessions per week, 4 to 5 hour per session. From our National Institute of Urology and Nephrology, they consisted of 33 male and 30 female with a mean age of 50 years. And the control group, which consisted of 20 apparently healthy with normal kidney functions, consisted of 13 male and 7 female with mean age of 41 years. The hemodialysis group is further subdivided into 3 categories depending on the level of the parathyroid hormone. Group A with a PTH level less than 150 picogram per milli. Group 2, subgroup 2, with the level of PTH between 150 and 300 picogram. And group 3 with more than 300 picogram for the PTH level. The exclusion criteria we have included in this study is bone diseases, either primary or secondary metastatic or bone fracture, infection, either bacterial or viral, diseases that affect the bone like rheumatoid arthritis, hyperthyroidism, hypercortisolism, and history of renal transplantation. The blood samples were collected from the patients, and the serum was then collected and stored, and the following parameters were measured: serum creatinine, blood urea, phosphorus, serum PTH, serum sclerostin, fibroplastic growth factor 23, and serum Klotho. So the results here, comparison between the control and hemodialysis group regarding this laboratory data, and here as regard the gender, we have found that the both serum sclerostin and the Klotho were significantly increased in male than female due to increased muscle mass. This comparative study between the hemodialysis group and the control group as regards sclerostin and the fibroplastic growth factor and high sensitivity CRP that shows high significant increase in these parameters in hemodialysis patient or hemodialysis group compared to the control group with increase in the serum Klotho in the control group regarded to the hemodialysis group. These figures shows the correlation between the serum Klotho and high sensitivity CRP and phosphorus, and this revealed high significant negative correlation with high sensitivity CRP and phosphorus, and a significant negative correlation with fibroplastic growth factor 23. And these figures shows correlation between fibroplastic growth factor and phosphorus, and fibroblast growth factor 23 and CRP, and this revealed a significant positive correlation with phosphorus and high significant positive correlation with high sensitivity CRP. These figures shows the correlation between Sclerostin and the CRP, phosphorus, and the Klotho. It revealed high significant positive correlation with high sensitivity CRP, a significant positive correlation with phosphorus and fibroplastic growth factor 23, and a significant negative correlation with Klotho. The conclusions: there is an association between serum Sclerostin level and serum phosphorus and serum fibroplastic growth factor 23 levels in hemodialysis patient. Renal Klotho synthesis diminished early in renal disease with increase in fibroplastic growth factor 23 production. In addition, the fibroplastic growth factor 23 Klotho excess is a solid candidate for a novel diagnostic and therapeutic target in CKD. Identifying the precise mechanism underlying the signaling pathway associated with sclerostin phosphate and fibroplastic growth factor 23 regulation require further investigations. Thank you.
Now we are moving to Dr. Ahmed Mekti, Mansour nephrology.